My name's Sean, and this is a 3-year-old Maddox.
I'm Jody, and this is Micah, and he's now 15 months, but adjusted age a year. I started having contractions at 23 weeks pregnant and was sent over to a specialist once we had an ultrasound after I started having contractions, and they saw that I had very little amniotic fluid left, and it was beyond the scope of the person that I was seeing any longer, and so they sent me to Dr. Bobrowski to decide what was going to be the next thing to do now that we saw that I was in labor and had no fluid left. So my contractions never stopped, and a couple hours later we were back at the hospital because my labor was progressing, and so once we were at the hospital, it was only a few hours later and Micah was born, and he was obviously rushed up to the NICU, and they first rushed down to get him.
Jody went into labor and ruptured membranes. Her bag of water broke, and it broke at 24 weeks and 3 days of pregnancy, which is really darn early. And there was not a lot of fluid anyway around the baby. The baby was in an abnormal position in the birth canal, bottom first, and she was laboring, and there was really not a lot of time to do very much. Now, in the womb, all respiration takes place in the placenta. Now we're expanding the lungs repeatedly, and even though we use the most gentle, high-frequency type ventilators to try to breathe for the baby and try to minimize trauma associated with breathing, there still is ongoing injury from the respirator and from the high oxygen. And that goes on for months, places the baby at a very high risk for developing chronic lung disease, which is a long-term morbidity that can affect the baby for many, many years after the child goes home from the NICU.
My impression of him was one that I have frequently with babies who are born extremely prematurely, and that is, this is a baby who is in a difficult situation under the best of circumstances. The nicest thing I found when I initially examined Michael was that he was well grown for as early as he is. So a baby born at 24 weeks can be very, very tiny, and he was, but he was well grown for his age, and that's an important thing that helps his prognosis.
So Micah responded well to the treatments and the forms of support that we offered to him, and that was an encouraging short-term outcome for him. But we still reserved long-term concerns because, again, Jody not having gotten antenatal steroids, we knew placed him at great risk for the intraventricular hemorrhage, for chronic lung disease, and also for significant eye disease.
We could see that he was slowly getting better. I remember at one point asking, at what point do I not need to fear that he could just not make it? I didn't know, and nobody wants to tell you. Now you're past the point of fearing that he's just not even gonna live. I mean, so it was, we learned a lot through the process. We, asked a lot of questions. They were very helpful in communicating the things that we needed to know as they happened, and the next milestone that we would be looking forward to. And so it was, it was a long road, but he did really well early on. He progressed, but the first several weeks were definitely the hardest as far as knowing day to day if he was going to be okay at all.
He did really well with tolerating his mom's milk feedings, and she provided phenomenal quantities of milk for him, which is essential for these tiny babies to do well. And that fact in and of itself, the fact that he did well from a nutritional standpoint, really bodes well long term for his outcome. And those babies that do well nutritionally early on and through that first year of life really do better overall. And nutrition cannot be emphasized enough when you look at how tiny babies do over the long term.
And I see families here every day. Every situation is very different. We are around preemies all the time. And he just had such a strong spirit, and he just did incredibly well. And it was just fascinating to watch that, and just to be a part of it, and to be there with them and mark the milestones.
The amount of support that we received from not only the hospital and March of Dimes, but also from our family and our community, like friends in their churches. It wasn't just like our church that kind of helped us along the way. Like, it was a lot of people that came together, and it was because we asked for it. You know what I mean? We said we need some help, you know, and we realized we couldn't do this on our own, and so, you know, we have, even to the ballet guys, I think they were really cool. To my wife that came here 3 times a day, and I mean, if you think about it, how much time did she save from not having to park her car every time, you know? Like, I don't know, I don't know, it was just a blessing to be able to receive from the people that owed us nothing, you know, they didn't owe us anything to treat us the way they did and to take care of us, so.
We all grew very close with them. He's very special, a very remarkable case, not only because he was with us for so long, but also because they're just a very warm, loving family. Micah was very remarkable in his progress, developing from an extreme preemie age through his discharge at 110 days of age.
You know, for a baby born as early as he was, with all the lung issues we had, and to go home without oxygen is phenomenal.
Micah being born at 24 weeks and 850 grams, especially without the benefit of the steroids before delivery, that his chances of surviving without either chronic lung disease or significant retinopathy of prematurity or the eye disease was 10% or less. So that made him, you know, that made the odds for him getting to that point pretty darn long, and yet he did. And that makes him a very miraculous child.
The whole situation with Micah being hospitalized and being born so early was really a true miracle for us. We knew that God's hand was on him, and that you know, the technology made a huge difference. He wouldn't have survived had it been several years earlier. Maybe even a few years would have made a difference in how well he's doing today. And so we definitely consider him our miracle. And our experience here was really a blessing because we felt so comfortable with his care, and so it was just a miracle.